Good evening. First of all, thank you to all South Africans. To me, the fact that South Africans responded in such a manner, we were surprised. This happened Monday night. I'm not on social media. And on Tuesday morning, we were flooded with calls from the media saying, you know what, that this has happened last night. The public went crazy. And I was really surprised with that kind of support. But look, we don't really look for recognition.
Yeah.
And we're not judging or prejudice against the human people getting an award for the good they have done. We accept that. And there's many people doing good in the country, the continent, and throughout the world. That's fine. That's the president's prerogative and that of the cabinet. Our intentions are very clear. When we serve for the benefit of the people. We don't expect anything in return. We don't wait for a thank you. We don't wait for recognition. And I'll explain that to you in a minute. When I got instruction from a Soviet teacher in Istanbul on the 6th of August, 1992, when he asked me to serve all people of all races, of all religions, of all colors, of all classes, of all cultures, of any geographical location, in any political affiliation, he said something very, very clear. He said, my son, when you're doing this, serve people with love, kindness, compassion, and mercy. And remember, the dignity of man is foremost. When you do this unconditionally. You don't expect even a thank you. In fact, in what you're going to be doing for the rest of your life, expect to get a kick up your back. If you don't get a kick up your back, regard it as a bonus. And then he said something very significant. He said, my son, that whatever you do is done through you and not by you. And you understand that this thing is spiritual, that we don't take credit for anything that is done because there's a higher hand over our work we do. So really, we had no issue not being recognized or not being mentioned. To us, 60 million South Africans recognize us. To us, that tells us after 28 years, we are in the hearts of every single person in this country. No Nobel Prize, no mention from the head of state, from any government, or any award in the world can replace that kind of joy and happiness to be in the hearts of every single person of your own country.
Dr. Sooliman, while we know the gift of the givers for your work to feed thousands in South Africa and around the world, also providing in drought and war-stricken areas, helping in fire-ravaged communities, and even lending a hand in rescue during hostage situations, the COVID-19 pandemic arguably was unlike any other disaster. Just talk us through the work that you have been conducting since the outbreak of this pandemic.
Well, in terms of, you're right, it's unlike any other disaster. It's a disaster that simultaneously has hit the whole world. Normally a disaster will hit one city in one country. We'll have a couple of disasters in some other countries at the same time, but no disaster hits the whole world at the same time. Secondly, a disaster lasts, for 7 to 10 days in an earthquake. We have search and rescue teams, medical teams, and thereafter it's a process of rebuilding. It's not a continuous disaster. But COVID-19 is a continuous disaster. Every minute, every hour, every day, almost a year plus now. So it's been a huge difficulty, and it's something you can't see. You don't know what this is. It's a virus that's attacking so many people, and it's attacking the people who are supposed to be saving lives, healthcare workers. Large numbers of healthcare workers have passed on in the second phase. And this is where we started. When the lockdown was announced, it was said that the lockdown was there to prepare the hospitals. So what is there to prepare the hospitals? You prepare the medical staff for protection with PPEs, and you bring in additional medical staff. Unfortunately, both of those were not done. You know the crisis that was in the PPE, 13 billion rand spent. Yes, it was spent, but what the PPEs delivered to the hospitals? We've been to 200 hospitals nationwide, and we haven't seen up till now, right now, today, we have been called for PPEs in various hospitals in the country. So that we have failed them in that aspect. It was not delivered. Secondly, and more importantly, the hospitals were already understaffed before COVID-19 started. And if there was any experience that we learned from Europe and America, because they were in a crisis same as before us already, we saw the toll it took on healthcare workers. So the prudent thing to do was to get healthcare workers, the foreign ones who work in our hospitals, medical students who studied overseas, we could have given them some kind of registration to be as backup for healthcare workers. That wasn't done. And we can see the effects right now, what's happening in the second wave. The third thing, which we got involved in testing immediately. We set up 10 testing sites, put up mobile sites to assist the country because we knew testing was a big thing in the beginning when the first wave started. We put up tents, 37 tents at a cost of 3 million rand each in various hospitals, because they wanted to triage the patients outside the hospital, not inside the casualty where the virus could spread. Then we brought in, of course, the PPEs of various kinds, all the hospitals. We spent millions of that. We brought in non-contact thermometers, pulse oximeters. And again, this was very worrying. When we brought a non-contact thermometer, I mean, it's not a complicated instrument. It's not even expensive. The nurses and the doctors started dancing, like we brought them a whole theater or an ICU. It shows they were so anxious that they were not even getting non-contact thermometers. So the question is raised again, did we do our job in preparing the hospitals? And I say categorically, no, we did not do our job properly. And that's why there was so much anxiety with all the doctors and the healthcare workers. Then we brought them scrubs. And then they needed high-flow nasal oxygen machines, which we delivered. And after that, many of them wanted infrastructure in place. We spent 10 million rand in doing a dedicated ward in Mitchell's Plain, a 60-bed dedicated ward. 30 days we did that. In sectors, we spent 750,000, and we put up 2 wards, for 20-bed ICU with high care, not high ICU, high care with oxygen points in 5 days. And then we put up a doctor's quarters in Bishu Hospital and put in a 120-bed facility there. So we bring a lot of things, but not only the medical side. We put in, one more thing, we put in 19 paramedics to help Levick's hospital and 6 nurses because they were short-staffed. The other thing, we got involved in boreholes, food distribution. 320,000 food parcels already. 100 soup kitchens we supported and providing fodder for the animals. So these are some of the things that we did in COVID, in the medical part of it. And if we come into a third wave, we have to correct to make sure there's enough medical staff for those hospitals. Otherwise, it's going to be a disaster.
Right, we are running out of time, but before I let you go, just briefly tell us what's next for the Gift of the Givers.
Well, it's the same thing that we've been doing all the time. Hospitals are still calling us. They still want infrastructure. They still need staff. They still need PPEs. They need the same pulse oximeters. They need stuff. We're carrying on with that. A lot of areas still want boards because they can't sanitize, they can't wash, they can't bring the medication. We put in 6 boreholes in Adelaide last week. Opened it. We're busy putting more boreholes in Pedi. We've got teams going in Makanda, in Aberdeen, in Hofmeyer, Pedi, the Fort Beaufort, Promi, all different areas. People want water because hospitals can't function without water. And there's so many hospitals without water. And of course, there's been a huge public demand on us to get involved in the vaccines. We're not involved in the vaccines. We don't want to get involved in the vaccine, but we're getting a lot of pressure from the public, from various quarters, from corporate, from medical societies, from the banking councils, everybody asking us to get involved. And we are busy, and we even spoke to the health department about this. There are a lot of issues taking place in the background, and maybe something will come up. We don't know, but we are busy with something.
And lastly, how can ordinary South Africans get involved with your projects?
Well, first of all, ordinary South Africans can do what's very important. We all talking about the vaccines. We all worried about, people talk about ivermectin, and all kinds of prevention. The best thing they can do is to make sure they take precaution. We can't be reckless. The biggest safeguard, the biggest vaccine, the biggest treatment, the biggest help in COVID-19 is prevention. Make sure you wear your mask. Make sure you sanitize. Make sure that you don't get involved in big crowds. And importantly, the super spreaders are the families. Because when we go home and we work in different companies, we all take the mask off. It's not appropriate. It's not politically correct to wear a mask in your own house. If you work in different companies, if you come back, you are at risk. You need to take care in your own homes. People don't say that. In the second wave, 4 to 5 family members have died per house. And it's because we're not taking the care. And the other way you can support us, of course, is to spread the word of what we're doing. You don't have to give any money. Just spread the word, and some you can afford it. Well, assist. Thirdly, if you want to give money, the details on our banks, on our website, or you can call in the weekday 0800 786 911. And of course, if big companies want to support us, they can call us. They all know how to get all of us to give big support, big items. But one last point, you don't have to support Gift of the Givers. You know people in your street, in your village, in your home, in your area that have been affected. Many people who are doing well, who lived well, have lost their jobs. And ordinary people have lost their jobs. Ordinary people are in difficulty. Quietly find them out, assist them quietly, it's dignified, it's beneficial. It's how South Africans help each other. You don't have to come to gift of the givers. Many of you know who the people in the country. Go and help them. They'll value you for the rest of your life.
Well, that was a Gift of the Givers founder, Dr. Imtiaz Sooliman, saying that even without a Nobel Peace Prize, they enjoy the support of over 60 million South Africans. Well,